Hi everyone, welcome to today's webinar. I'm delighted to be joining you today to discuss manual handling. My name is Caroline Rain and I'm a health and safety expert who actually chose to specialise in chemical legislation and chemical regulations. But of course, manual handling is an integral part of health and safety and is definitely a topic that is very close to my heart. I think it's important, a necessity, in fact, a right that everyone goes home from work in the same condition in which they arrived in, and no one should be harmed in the workplace. Now, before I get started, I just want to express my thanks to Croner and to Rospa for the invitation and for putting their trust in me to deliver today's webinar. And of course, to you all for attending today as well. And thank you also goes out to Ben and Daniela for all their help and hard work in the background as well. Thank you. So throughout today's webinar, I'm very happy to take any questions that you may have. Please do pop them in the chat box, and we will have a Q&A session at the end of the webinar. But also, if you have questions that perhaps you don't necessarily want to discuss live as well, then please do feel free to reach out to Rospa, and the questions will make their way to me, and I'd be happy to answer them at a later date. So, Ben, if you wouldn't mind moving me on a slide, please. We'll look at what today's webinar will cover. Thanks, Ben. So we are going to look at what manual handling is. It probably seems very obvious and straightforward to you. And actually, it is definitely common sense as well. But I think it's worth mentioning it and setting the scene. We will then look at the legislation that is relevant to manual handling so that you understand both your legal obligations, your employer's legal obligations, and your colleagues' legal obligations. We'll discuss some of the hazards, risks, and injuries that could occur, but of course they're not going to because you're going to be ace at manual handling after today's session. We will look at identifying and evaluating manual handling. Especially around the risks, otherwise known as the risk assessment. And then we'll discuss some of the strategies that are available to help reduce those manual handling risks. So we'll talk about some of the mechanical aids or good handling techniques. And then we will also look at how you can implement effective manual handling training as well. So again, if we could move on a slide, please. I can see there's some questions in the chat already around whether or not the slides and the recording will be shared, and it's my understanding that they will be. So you should get copies of them afterwards. And I think there's a couple of technical issues as well. I'm wondering if Ben can help with them as well. Yeah, great. So thank you. So this webinar is really important today because it sets out how employers must deal with the risks relating to manual handling. Now, the first thing that you really need to consider when you are looking at moving a load is how imperative is it to move that load? Now, generally, when we're discussing manual handling, we're talking about the load. Now, that could be any kind of object that needs to be moved. Ideally, you want to be in a position whereby you avoid moving anything that is required to be moved. So the idea behind any risk assessment when you're looking at health and safety is to eliminate the risk or the thing that you're trying to achieve. So ideally, you want to be at a position whereby you can avoid the hazardous manual handling, and the regulations use the word so far as reasonably practicable. If that's not possible, then what you need to be doing is assessing the risk of injury from any hazardous manual handling operations that you cannot be avoiding. And then what you need to do is you need to think about reducing the risk from hazardous manual handling, again, to as low as reasonably practicable. And we'll talk about all of these aspects a little bit later on. But the one of the other things that I always think is really interesting is that the weight of the load is important, although the law does not set specific weight limits. So you will hear some people talking about 20 kilograms, but the legal text itself does not specify specific weight limits. And that's because everybody's different. Everybody is capable of moving different weights and different loads and different shapes and different sizes. We're all very different and unique as individuals. And therefore, it's very important that you don't make assumptions and you don't come up with a one size fits all strategy. And that's why the law does not specify a specific weight limit. Now, all of the points that are listed on this slide here are all spelt out in the legal text. And they say that there are a number of employee or employer duties that must be abided by. So both employers and employees have legal obligations. So if Ben would be kind enough to move on to the next slide, please, we can look at those legal requirements. So in order to, let's look at the employer's duties before we move on to the legal text. So in order to avoid manual handling at work, so the employer is really duty bound by the legal text to avoid manual handling at work where you can do so. So that's back to that first stage that we talked about, that elimination of moving the load itself. Now, if that cannot be avoided, then a manual handling risk assessment must be completed. And like all aspects of health and safety, risk assessment really is one of the core fundamental parts. You really need to look at the process, the task, look at what it is that is being tried to be achieved, and then look at whether or not the risk is acceptable. And where the risk is not acceptable, you need to put controls in place in order to reduce the risk. So funnily enough, one of the next employer duties is to reduce that risk of manual handling activities as per general health and safety. And you are expected to record the risk assessment where there are 5 or more employees as well. And then it's very important as well that manual handling assessment is reviewed on a regular basis. So I normally suggest to businesses that you review your risk assessments in general, as well as your manual handling assessments when there has been some kind of change to the process or activity, when there has been a change in the legal text, or at a regular period, and you may as a business choose to do that on an annual or perhaps two yearly cycle. If you wouldn't mind moving on to the next slide, please, Ben. So let's have a little bit of a closer look at what manual handling is. So manual handling refers to any activity where you transport or support a load. And generally, the term load is used within the legal text. But by load, we could mean a box or a person or equipment, really any kind of object. And when we're moving or transporting or supporting that load, it is generally either using your hands or bodily force. And it could include activities like lifting, lowering, pushing, pulling, moving, or indeed carrying as well. And so manual handling includes a very wide range of activities, such as that lifting, lowering, putting down, pushing, pulling, carrying, or moving objects. And the load is the object and that can be anything that is moved or supported. So within the workplace, boxes, packages, people, animals, or even equipment like pallet trucks as well. Now, manual handling is a common cause of workplace injuries, especially when you look at some of the RIDDOR reporting incidents that are available to review. Many of them are as a result of manual handling. And so it is really crucial to understand the risks and make sure that businesses implement safe practices as well. So what kind of common injuries can you see? Well, again, when looking at some of the RIDDOR reporting incidents that have happened, the injuries can include sprains and strains of muscles, ligaments, tendons. Back injuries are very common, as are bone injuries, nerve injuries, tissue injuries, and there can be as a result of acute and chronic pain. So what do I mean by acute and chronic? Well, acute means short-term in the moment pain, whereas chronic is a longer term injury, something that lasts a longer period of time. Now, that all sounds incredibly scary, but if you remember, I said that it was very important that people go home from work in the condition that they arrived in, and it's one of the biggest passions that I have is to make sure that nobody is harmed. And the good news is that you can implement a series of safe practices that will keep you safe and will make sure that these injuries are indeed avoidable. So good manual handling techniques involve really having a plan to do the lift, making sure that you're using proper posture, keeping the load close to your body, avoiding twisting or bending excessively. And we'll look at some of this in a little bit detail later on. So just before we want to move on, I just really want to be sure that everybody is happy with what manual handling is. So a couple of examples, perhaps you might need to lift or carry boxes or bags or materials. Maybe you need to take a ream of paper to the printer, for example. That would be aspects of manual handling. I've got lots of thumbs up, which is fabulous. So I guess you're all happy about what manual handling is. That's great. I remember pushing and pulling is also part of it. So it may be that you have trolleys or pallets that you're trying to move in the workplace. Sure, many of you do that when you pop to your local supermarket. Now, of course, the regulations don't apply to you as members of the public, but what you learn today will not only help you within the workplace, but it will also help you in your general day-to-day life when you're moving loads, objects around the house and in your private lives as well. Reaching is another aspect that we haven't covered off, but maybe trying to reach for something high in your kitchen. There's also the twisting and bending down to pick up or place objects as well. And you'll learn a little bit later on about the fact that we really want to be, where possible, avoiding those twisting movements when we're moving loads. Okay, so let's have a look at the legislation. So Ben, if you could move me on a slide, please. So the main legislation that we have is within the UK, and I'm really just talking about the United Kingdom regulations rather than the EU regulations. The main legislation that we have is the Manual Handling Operations Regulations 1992. Other relevant legislation includes the Health and Safety at Work Act 1974 and the Management of Health and Safety at Work Regulations 1999. And they've all got their abbreviations that sit alongside them as well. So generally, the manual handling operations is referred to as the MHOR, the Health and Safety at Work as the HSWA, and the Management of Health and Safety at Work Regulations, the MSHWR. I have to say none of them are especially catchy, but they are the way that we refer to these regulations. So let's look at a little bit more detail about the regulations and what they require us to do. So if you could move on again a slide, please, Ben. Let's have a look at the Manual Handling Operations Regulations 1992 to start with. So we've learned so far today that there are duties for employers and employees, and the manual handling operations regulations really spell out what those duties are. And the regulations require employers to avoid hazardous manual handling tasks if reasonably practicable, and requires employees to follow safe systems of work and use equipment safely. So far we've talked about the need for eliminating the actual manual handling, and the need to carry out a risk assessment and then minimise the consequences. But now we're starting to look at some of the duties that also sit alongside employees, which is around making sure that you follow these safe systems of work and equipment safely as well. Now, I don't have a slide on the other sets of regulations, but just to make you aware that the Health and Safety at Work Act also requires employers to make the workplace as safe as is reasonably practicable. And the Management of Health and Safety at Work regulations requires employers to conduct those risk assessments and implement preventative measures, and requires employers to regularly review those risk assessments as well. So if we could move on a slide, please, Ben, let's have a look at some of the hazards and risks associated with manual handling. So we've talked about the fact that manual handling is around the movement of load, and that could cover off any of the things really that are listed on this slide. But here we want to focus specifically upon the hazards and risks. So when you're lifting heavy objects, that could be heavy or bulky loads, lifting or carrying excessively heavy or awkward objects increases the risk of injury. Now, it may be that you're okay to move one or two heavy loads, but by the time you get to the fourth or fifth, it is starting to become harder and harder to move. But when it comes to manual handling, we shouldn't be at the position where you are getting progressively worse as you're moving on with the manual handling. It should be about avoiding that manual handling in the first place. So this particular manual handling, lifting of heavy objects, comes about in just about every industry. It could be transporting a construction load or a heavy box, or maybe furniture, or carrying a patient if you're working in hospitals. And now heavy lifting can strain a person's spine, joints and muscles. And recognizing and using the correct manual handling techniques, asking for assistance and using the right equipment can help to reduce those associated risks. And we'll talk about those different controls that you can be putting in place a little bit later on. Repetitive movements, repetitive lifting, pushing, pulling, in fact, anything that is repetitive can lead to cumulative injuries over time. So even in cases where the loads aren't particularly heavy, performing the same activity over and over again can strain joints and muscles. And that can lead to injuries like tendinitis, repetitive strain injuries, and that can cause chronic pain. So if you remember, chronic long-term pain, and it could impact your performance over time as well. So an option is there to take regular breaks and make sure that you are stretching the muscles to avoid strain. That can help you to prevent this type of manual handling injury. Poor posture, twisting, bending, reaching while handling loads can strain the back and other muscles as well. So poor posture is a very common hazard that can lead to manual handling accidents and injuries. So I often see individuals that are lifting with their backs instead of their legs, for example, and that's a common mistake that employees can make when it comes to moving loads. And that can increase the risk of problems with your back, musculoskeletal disorders, leading to temporary or even longer lasting neck and shoulder pain, as well as the back as well. Poor grip. So alongside poor posture, poor grip is another or one of the most common factors when looking at the hazards that are involved with manual handling. Often as a result of rushing or a lack of planning, poor grip can increase the risk of objects being dropped, which can lead to not only the object being damaged, but also potential injuries as well. Slips, trips and falls. So according to the Occupational Safety and Health Act, which is the American legislation, slips, trips and falls cause 25% of yearly injury claims. So financial claims that are set aside to businesses. Within the health and safety statistics that are reported within the UK, the statistics are around the same, around 25% are as a result of poor slips, trips and falls as well. So what are the problems with slips, trips and falls? Well, they hurt. They can cause sprains, strains, confusion, fractures, lacerations as well. And now these slips, trips and falls could be as a result of slippery surfaces, transitioning from one surface to another, navigating obstacles. It can be quite difficult when you're moving loads to be able to see what lies in your path, and therefore can often result in slips, trips and falls. So it's imperative that we design safe workplaces and processes, and that we maintain good housekeeping in order to avoid the hazards of manual handling when it comes to slips, trips and falls. I suppose it's also worth adding and mentioning that there are environmental factors as well. So poor lighting or slippery floors or obstructed pathways can also increase the risks of slips, trips and falls, especially when carrying objects. And lack of training, a lack of understanding. Employees who are not properly trained in manual handling techniques are at a higher risk of injury as well. Now, this list is by no means exhaustive. There are plenty of other things that I could be mentioning here, and I am struggling to keep an eye on the chat while I'm presenting. We'll definitely come to it at the end of this session when we'll look at some questions and answers. But of course, I've seen people mentioning environmental conditions. I've seen the words DSE assessment appear on the screen as well. And you're absolutely right. These are all very important things that need to be taken into account and consideration. Ben, if you wouldn't mind moving on, please, we'll just quickly mention some of the injuries that can occur. So manual handling, I've already covered off some of the injuries that can occur, but I think it's worth just kind of spelling it out in a bit more detail. So it can cause strains, injure muscles, ligaments, tendons. It can lead to back pain, shoulder pain, neck pain. Generally, these things are often grouped together into musculoskeletal disorders, MSDs. I find that a bit of a mouthful to say, but it is certainly the grouping of the terminology that is used. Now, back injuries do tend to be the most common type of manual handling injury, alongside those slips, trips and falls. And it can often result from improper lifting techniques, heavy loads, and awkward postures. And of course, we've also talked about the strains and sprains, cuts, bruises, and in some cases, it can even result in broken bones as well. Now, muscular sprains and strains often involve overstretching or tearing of muscles and ligaments when lifting overly heavy loads or making sudden movements during lifting. Trapped nerves can be as a result of repetitive movements or maintaining awkward posture, leading to pain and numbness. Hernias are often painful protrusions of tissue that can be caused by excessive strain and improper lifting techniques, especially when heavy objects are being moved without core support. Cuts, bruising, abrasions can come from contact with sharp or rough edges or surfaces when handling materials, and it can often be as a result of poor grip or a lack of protective equipment. Fractures and broken bones can occur when a heavy load is dropped, or if a person slips, trips, or falls during a manual handling task. And many of these are a range of chronic conditions that can affect your muscles, tendons, joints, impacting the body's movement. And we've covered off a lot of the terminology around some of the injuries as well. But something else that is worth mentioning is carpal tunnel syndrome, which affects the movement of shoulders, hands, and wrists as well. Okay, Ben, if we could move on another slide, please, let's have a look at the manual handling assessment. So manual handling light is a mnemonic that is used to help remember 4 key areas to consider when looking at the risks of manual handling tasks. So light stands for load, individual, task, and environment. And we can look at this in a little bit more detail. So the load, that refers to the object or the person or the thing or the animal or the furniture that is being moved. And it includes the weight, size, shape, and how easily it can be handled. Individual is looking at the capabilities of the person that is performing the manual handling task, such as their physical strength, their experience, and any limitations that they have. Now, the capabilities of each individual person does entirely depend upon that person's individual. So some people will be more than capable of carrying something that's a couple of kilograms, whereas others will be capable of carrying much more, and some will be capable of carrying much less. So as I mentioned earlier, it really is important to take into account the individual that's doing the work, because we are all so very different. We've got the task. Now, the task involves looking at the nature of the manual handling itself and the type of movement, whether or not it is lifting, pushing, pulling, or carrying, and you need to consider the motions that are involved. And then environment is where we're looking at the surroundings where the manual handling task is taking place, including the potential hazards and the obstacles as well. I noticed that, again, I saw some of the comments in the chat flashing up, and I noticed that some of you are using Tile and Tileo, where we're looking at the other aspects, and that's absolutely fine. When you're doing your risk assessment, it's important to consider all aspects, and if you've got other acronyms that help you to remember, then that is absolutely fine. So when you're looking at the risk assessment, then whichever process it is that you're following is there to help you to identify and assess the risks. And it is also there to help you look at the areas whereby you can take active, proactive steps in order to reduce the injury and promote the safe and manual handling practices as well. So when you are looking at your risk assessment, it's important that you carry out a thorough risk assessment to identify any potential hazards and assess the level of risk with your manual handling. So there are a number of control measures that you can put in place. You can either eliminate or reduce the need for manual handling by using mechanical aids, which we'll talk about a little bit later on. You could look at automating tasks, or perhaps even redesigning the workplace in order to minimise manual handling. You can also improve workplace practices by training employees in safe manual handling techniques, providing adequate rest breaks, and ensuring that there is proper job rotation within the workplace. You must ensure that you've got proper equipment, so by providing employees with appropriate tools and equipment, such as hand trucks, dollies, or lifting devices. Also, personal protective equipment isn't something that we've covered off, but having the correct PPE in place is also important in order to protect your employees as well. There are modifications that could be made within the workplace, so improving the lighting, making sure that you have clear pathways, and ensuring that floors are clean and dry as well. And then it's very important to document the risk assessment. And in fact, that's a legal requirement if you have 5 or more employees. And you should be keeping a record of the hazards that are identified, the risks that are assessed, and the control measures that are implemented. So again, if we could move on a slide, please. Ben, we'll have a look at this in a little bit more detail. So to reduce the manual handling risks, we need to look at prioritising elimination, substitution, using mechanical aids, and optimising the workplace layout, providing proper training, and ensuring that we have adequate breaks and rest periods. So we are going to prioritise substitution or elimination. So is there a real need for that manual handling exercise, or could the task be automated or redesigned so that it requires less or no manual lifting? Redesigning or automating the system could involve introducing mechanical aids such as conveyor belts, perhaps, that can move the load from one part of the area of the business to the next part of the business. If manual handling is completely unavoidable, can you replace the heavier awkward loads with lighter or easier ones to handle? So can you break it down into smaller pieces, for example, or can you move away or to redesign the shape or the size of that particular load? We will talk a little bit more about mechanical aids just shortly, and we will talk about optimising the workplace shortly as well. So you could think about reducing the carrying distances. So perhaps the workplace could be redesigned in order to mean that it's a shorter distance that you need to be moving the load between. You could also think about having storage at better height conditions so that when you are lifting or when your employees are lifting the load, they're lifting it at waist height rather than having to bend down to pick up a load or to stretch up high to pick up a load. You could think about making sure that everything is a comfortable height. And again, you will need to think about the different shapes and sizes of your employees there as well. Improving access is important, so making sure that you've got clear pathways and adequate lighting to avoid obstructions and improving visibility as well. Training is really crucial as well. So you need to be teaching safe lifting techniques, training employees on proper lifting, bending and carrying techniques to minimise the risk of injury, and assessing individual needs as well. So you'll need to consider the individual abilities and limitations when you are assigning tasks to the workforce as well. Regular breaks need to be considered, so allow for frequent breaks to rest muscles and prevent fatigue. Vary the tasks to avoid repetitive movements and reduce strain on specific body parts as well. And identify the hazards. Regularly assess manual handling tasks in order to identify potential hazards and risks, implement control measures, develop and implement appropriate control measures in order to mitigate any identified risks as well. So if you do have to move a load or your employees are having to move a load, then you must remember the manual handling principles, whereby you should be planning the lift, position the body and feet correctly, and pick up the item using good posture, move it towards the desired location, and then place the object down safely as well. So some additional tips to consider, make sure that you are bending with the knees in order to make sure that you are keeping your back straight so that the load is being moved by your legs and not your back. Grasp the object as closely to the body as possible so that you are carrying the load close to your body and not having it much further out. Avoid twisting your body and ask for help if it's needed as well. And make sure that you take care if you are also handling hazardous materials too. Okay, so let's move on to some mechanical aids. Thanks, Ben. Moving on to a slide. So let's look at some of the strategies that can be introduced in order to reduce the manual risks, so the use of mechanical aids and good handling techniques. So there are a number of different types of equipment that can be used. So, for example, trolleys, pallet trucks, forklifts or other mechanical aids can be used to assist with moving of loads. I talked about conveyor belts earlier on as well, But if you are using equipment of any kind, it's very important to make sure that this equipment is maintained, that it is regularly inspected and maintained in order to ensure that they are in good working order and that they are safe to use. What we don't want to do is introduce mechanical aids in order to reduce the manual handling risks and hazards and in fact injuries, and then end up introducing new hazards and risks by not having mechanical aids that are in good working condition. So balancing manual tasks with mechanical aids and protective equipment can significantly reduce the impact and the injuries that are associated with manual handling. Trolleys, hoists and lift devices can help teams safely manage loads. For example, other examples that are worth considering are adjustable workstations and conveyor belts as well that are reducing the need for repetitive lifting. So again, if we could move on a slide, please. And we talked about this ever so briefly earlier on, but we talked about the need to review your manual handling assessments, and I just really wanted to spell it out here that they should be reviewed in the unfortunate case of an incident. So if you've had some kind of accident or incident involving manual handling, then you should absolutely be carrying out an accident or incident investigation, but then also be reviewing your manual handling assessment as well to see if there's something that needs changing. If there has been any change in the activity, and by that I mean a change in the person, or maybe you've changed the weight of the load or the size of the load, or there's been a change in legislation, and then it's important to always factor in a periodic review as well. And then again, if we could move on, please, Ben, let's have a look at training. So how do you effectively communicate manual handling training? Well, one of the best ways to do that is through training. And it should include an explanation of what manual handling is and how injuries can occur, and pretty much of what we have covered today. It should also include a demonstration of good handling techniques. So get practical with your employees or your trainees. Show them how to move things. Make sure that you remember the manual handling principles of planning the lift, positioning the body and feet correctly, picking the item up using good posture, making sure that you're using your legs and not your back, moving towards the desired location, and then placing the object down safely, again using your legs and not your back. So you should always be bending with your knees to lift, and you should have the load as close to your body as possible, avoiding twisting, and obviously be aware that you should be asking for help as well. I think also that your training should include a description or use or practical aspect of how to use any mechanical aids that you introduce. So it's important to show your employees and your trainees how to use those mechanical aids safely. So if they're using suck tracks or trolleys or conveyor belts or any kind of mechanical aids, then it's important to show them how to use them correctly. It's also important to educate them on the maintenance schedules that need to be in place as well. But it's also important that they are aware as to how they can report any faults that are available there with those mechanical aids as well. Also part of the training should maybe consider aspects of how to report any incidents that are associated with manual handling training as well. And now this should be part of your wider health and safety policies and practices, but it also must be communicated to your team as well. If we could move on a slide, please, Ben. Now, the Health and Safety Executive on their website has explained what they feel that the training should cover and the fact that it should be relevant to the type of work that is being carried out. But they suggest that it contains manual handling risk factors and how injuries can happen, how to use mechanical aids, how to carry out safe manual handling, including good handling techniques, systems of work that is relevant to the worker's task and environment, and practical work so the trainer can identify anything that the trainee is not doing safely, and then they can help advise and put that right. So again, if we could move on to the last slide, please, that we've got. Well, actually, I think I've got a couple more slides, but the next slide, I should say, is looking at the summary. So it is very important when you are doing your manual handling that you take your time and that you really do think about what it is that needs to be achieved. And then sorry, something's just jumped on my screen, that you plan it and that you risk assessment. You need to think about whether or not it really does absolutely need to be moved. Can you be eliminating it? And if you can't, what can you do to use it to make it safer to move? And then you need to think about reviewing and reconsidering what it is that you're doing. And it's also very important that if at any point anybody within the workplace, be that an employee or a more senior member of the team, if there's something that you see that isn't right, then you should be stopping, having a discussion about it, and then making your recommendations in order to improve it. And that goes for health and safety as a general rule, that if you see something that isn't right, then you should be stopping it. Again, if we could then move on to the last slide, we've got to the point where we're at the Q&A session. So I'd like to thank everybody for your attention while I ran through the manual handling. I can see that in the comments there's a whole wealth of questions and comments around manual handling and what about this and what about that. And it's really important to mention that this has just been a quick, like 40 minutes run through of manual handling. I could spend all day talking about it, so I absolutely haven't covered everything off. There's some really good recommendations in the chat, and I want to agree with most of them, although I haven't read through all of them. But I agree that there are other aspects that you need to be considering when you are looking at manual handling and health and safety. And I think
so Caroline, sorry,
yeah.
I thought I'd jump in here, just make make the life a little bit easier for you. As the questions have been coming into the chat, I've been compiling though a few of them for
well
you,
done,
and
Ben.
it's great to see that obviously everyone in the chat is answering each other's questions and giving each other tips, and that's exactly what we want from these kind of webinars. So more than happy for that to have happened. But I think there's been a few that haven't been answered. So if you're happy with that, Caroline,
Yeah,
I
go
can
for it.
sort of bring these to you now. So. One of them has come through from Manjeet, which is, how often is it recommended should we carry out refresher training with colleagues that have been with us for a long period of time?
Yeah, that's a good question, isn't it? And it's an excellent question that will depend upon the situation and the risk. I probably can't give you a ballpark answer on that one because it will depend upon the scenario and the situation and the risk. If it's a high risk job that the individuals are doing, then you want to be doing that refresher training on a more regular basis. Whereby if it's lower risk, then I think you can probably have longer time periods in between them. It will also depend on whether or not you think your employees have picked up some bad habits along the way, and therefore you want to be including that refresher training. I do a lot of work with many companies that are working in warehouses, so standard manual handling of picking off of shelves and taking them to the boxing up area, and then getting them things out for dispatch. And most of them work on an annual refresher training for manual handling. So that would tend to be a good kind of rough ballpark, I would say. But if you've got something that's a higher risk activity, you might want to consider doing that on a more regular basis. Do spot checks as well. And if you think that you're seeing things that are wrong or areas for improvements, then again you might want to be increasing the frequency of that training, or maybe you want to introduce more toolbox talks in kind of the interim periods. But yeah, I would say most businesses are going on a roughly an annual basis.
I agree with that. Yeah, I know at Rosper we do obviously we run a lot of events and in-person events, and I think as part of the events team I have to run I have to be involved with that manual handling training at least once a
Your
year.
annual, are
And I
you?
think
Yeah.
every time we get out one of those a briefing for an event, there's all the manual handling refreshers inside that as well. So it's always good, any opportunity to get it out there when we can. A couple of other questions that have come in then is what about low risk office environments? Other than the legal requirements, is a basic risk assessment and basic training enough? And that's from David.
Yeah, I often think that offices don't generally do enough on manual handling. I think people often assume that because you're sat at a desk, you're not doing an awful lot in the way of manual handling. But of course, files and reams of paper and bending down for boxes and files. And I know we're much more electronic now, but I often think that general office activities don't necessarily cover off manual handling enough. They seem to be very good at doing the display screen equipment assessments and making sure that our desks are set up in a good place and that our seating is correct, but they don't often consider off the manual handling enough. And so I think that there's more that can be done in an office environment. Yes, it's lower risk, but you've still got the potential for these manual handling injuries. And you can actually get some good online training that can be done. I think perhaps the one you do, Ben, is an online one that you've referred to, and they're pretty good, and they would cover off a lot of the risks associated.
Yeah, I think that covers the a question from Sylvia by the looks of it, which is referencing refresher courses. Would e-learning be sufficient, or does it depend on risk? And I think obviously if you've done that in-person event in the first place, of course it's great to have in-person refreshers, but having an online refresher is it is sufficient, so long as I think the in-person has been done in the first place is obviously the best way to look at that one.
Yeah,
Um,
I think it also depends upon how often people are moving loads. So I'm very much office based, and yes, I do move the odd file and the odd piece of paper, but it's not on a regular basis. Those that are working in warehouse conditions are moving stuff day in, day out, every minute, every hour, and therefore it's done on a more regular basis. So again, it's a risk-based approach that I think that needs to be undertaken, and those that are consistently moving loads need to have the training on a more regular basis, and that training needs to be more intense than those that are doing on a less frequent basis. Um, Having said that, it only takes one bad movement for you to cause that injury as well. So you do need to make your own business case and business based decision. But online training is sufficient. The health and safety executive have put their list together of things that the training should cover off, and most of the online training that I see covers them off quite nicely.
Absolutely. I think we've just got one more question here from Rob, which is I've got to make sure I get my acronyms right here. Should MHOR, load weight, relevance to an aging workforce, be approached on a case by case basis as with a generic tile process?
Yeah, it's a really good question, isn't it? I'm not so sure that we can necessarily take into account individuals' ages. Up until quite recently, I couldn't lift a massive amount of weight, and actually, the older I've got, the heavier I can now lift because I'm putting more of an effort in with the training that I'm doing. So it isn't necessarily always an age thing that needs to be taken into account and consideration. I think there's a lot of things that need to be taken into account when you're looking at individuals, but you've also got to be very careful that you're not making too many sweeping judgments or assumptions as well. And therefore, the best approach that you can take really is by eliminating moving of the loads in the first place, and then introducing some of those safe handling techniques and mechanical aid so that you're avoiding that need to be quite so assuming and judging, because it doesn't necessarily always end very well when we put sweeping statements across individuals. So my advice would be to eliminate and reduce rather than focusing too much on the individuals.
Absolutely. I think that's from a question point of view, that's all of the ones that haven't been answered by everyone else who's attending in the chat. Which again, thank you for doing it. It's great to
Yeah,
see
we've
those
got some
conversations happening.
fabulous expertise on the people that are joining us. I can see some really detailed comments and some really helpful questions that have come back again. So thank you very much for doing that. I think there was a lot of questions around the acronym. I chose my light acronym because it's a nice, simple and straightforward one. But as I can see in the chat, loads of people have referred to other ones, and maybe I should have opted for a different one. I think the point is to make sure that you do your risk assessment adequately. And if you've got a better acronym that helps you to do that, then absolutely fine. And maybe what I'll do if I'm ever doing this webinar again is I'll maybe put 3 or 4 of them up there to show that there's different ones that could be being used, because that's really helpful. Thank you. So yeah, so thanks for everybody's comments, really.
Absolutely. Well, I'll let you go through your last 2 slides, and then so back to you, I guess.
Yeah, so I think the last slide was really just to let everybody know that if you wanted to be doing a platform demo, then you're more than welcome to get in touch, and we would be happy to set one up through Croner-i Navigate Safely. If you wanted to have a free demo of what the platform can do on the health and safety side of things, then please do get in touch. And then just to say thank you. So my thanks really has to go to the team at Croner and to the team at Rosper in particular, Ben and Daniela. And thank you very much, all of you, for your attention today and the comments. I've loved all of the engagement. Thank you all very much for joining us today.
Thank you very much, Caroline. And then on that note, I'm going to go ahead and pull this webinar to a close. As I did say in the chat, just in case anyone didn't see it, we will be providing a copy of this recording to everyone who has attended today. So yeah, thank you all for attending. Thank you, Caroline. And I hope you have a good rest of the day.
Thank you very much. Bye.